Alright, so when you're going to transfer a patient from the bed to the chair, the first thing that you want to do is check the patient's medical record to make sure that there aren't any medical issues that would indicate not transferring the patient or that you need to be aware of while you're transferring the patient. You want to make sure that you know of any IVs, any incisions, any tubing, devices such as Foley casts, wound vacs, SCDs that the patient may have in place, so that there aren't any issues when transferring them. Next thing you want to do when you come to the room is perform hand hygiene and introduce yourself, identify the patient, and let them know what you're going to be doing. After you've done that, you can clear the area, make sure any equipment's out of the way, that the area is clear for you to transfer. Bring the chair close to the bed. Next thing you'll do is lower the side rail and put the bed in the lowest position. Then you'll bring the patient's head of bed up as far as they can tolerate. So when the patient's head of bed comes up as far as they can tolerate, then you'll have them turn their body and bring their legs to the edge of the bed. Okay, and then the next thing you're going to do is just ask them, are you dizzy? If they're feeling dizzy, you'll have them dangle their legs for a few minutes until this has subsided. You want to make sure that you put a robe on them or any clothes that's appropriate, as long as they're appropriately dressed. Then you want to make sure that they, work as much as you can get them to work. So have them use the top side rail to assist, any ambulatory aids that they might use, have them use these to help stand if indicated. You can place a gait belt around the patient as indicated and per facility protocol. Then after you have gotten the gait belt on the patient, you want to have them scoot to the edge of the bed as far as they can without coming off the bed. You want to make sure that you're standing close to the patient at an angle facing them with your foot outside of their feet. Make sure that you put their non-skid socks on as well because you don't want any falls. And then you'll turn towards the patient. When you're going to do the transfer, you want to make sure you bend at the knees and the hips and not using your back. Save your back. So you'll bend at the knees and the hips. Make sure your back is as straight as possible. You'll have them hold on to you. No, not arms. Right here. Okay. And then you'll grab onto them, come as close as you can, and then you're going to rock, and then on the count of 3, you'll bring them up. So 1, 2, 3. Stand. Good. And then you'll use your back foot to pivot and sit down. Good. Once you get them in the chair, you'll get them comfortable. Make sure their back is in alignment. If they're comfortable with leaving the gait belt on, you can leave that on so that it's already in place when you go to transfer them back to the bed. And then once you've gotten them comfortable in the chair, you'll take your PPE off, wash your hands, and you're done.